Oh, hello. How are you doing? Great. Please come in and have a seat. I'm actually really excited because you are my first patient. Well, actually, you're the first patient that I'm helping by myself. Usually I have somebody with me, but today I don't. And please don't worry, you are in safe hands. I know exactly what I'm doing. Okay, are you nice and comfortable? Good. Now, before we get started, I have to get just some basic information off you to put inside the system, okay? So, your full name. It's a very beautiful name. Date of birth. Your home address. Can you spell that? Okay. And your email address. Gmail? Great. Now that's all in the system, I have more questions, but different type of questions that I want to ask you. So my first question is, how many hours of sleep do you normally get per night? Okay, that's good. That's really good. And usually what time do you go to sleep at? How much water do you normally consume per day? All right, so a little bit more is needed. I would recommend between 1.5 liters, 2 liters if you can. But since you're not really drinking that much water, I would recommend starting off with 1.5 liters of water, okay? Very good. But we can do that baby steps. Do you exercise? And if so, how many times a week? Okay, and what type of exercising do you do? What does your typical day look like for food? So, for instance, what do you normally eat for breakfast, afternoon, dinner? That's okay if you don't remember exactly. Let's take yesterday, for instance. What did you have for breakfast? Can you remember? Okay. And for lunch? Yummy. Very nice. And dinner. Do you normally snack throughout the day? All right, and we're nearly there. Oh yeah, you didn't mention any vegetables. Do you normally eat vegetables? Okay. Okay, I would really recommend increasing your veggies, especially your leafy greens. So that's like spinach, broccoli, all that good stuff, because they're very, very good for your brain health. So increase them if you can, okay? It's very important. Oh, yeah, and one question I forgot to ask you. When you wake up, do you normally feel restored and rested, or do you tend to wake up tired and feeling slow, heavy? Okay. It's not a good feeling. All right. And that's our questions. What I would really try to focus on if I were you would be my water intake. Try to increase it at least a little bit and keep exercising 2-3 times a week. It can be something light, like maybe watching some videos with people dancing, and you can do the same, maybe a nice jog or even like yoga or something like that. Doesn't have to be very intense. And your veggies, please try to increase them. It's very important. All of these things will help you feel better, helps your mind, your body, everything. All right, so the first thing that I want to do is have a look at your ears. I'm going to get you to stay nice and straight for me. Head up, just like that. Try not to move around. If I need to move, I will move around you, okay? So all you have to do is just relax, and I'll do the work. Let's begin. At the first look, it seems to look quite healthy. Your left ear is looking really good. Do you have any problems with your hearing? Okay, so you haven't noticed anything. Okay, so the same. That's good. If you are enjoying this video so far, please make sure to subscribe to the channel and help me reach 2K. Thank you. Your left ear doesn't seem to be clogged or even, I don't see any inflammation. Do you experience any pain? Alright, so not at all. Good. Try not to move. And let's have a look in the other ear. This one seems a little bit more clogged, but not a lot. Yeah, it's nothing too drastic. Just needs a little extra cleaning, that's all. Nothing crazy. And after I'm done, I think you'll be able to hear a little bit more clear in this ear. Just let me know if you feel any discomfort. How do you feel? Great. And I'm going to add in some drops in each ear and then some cotton wool inside, okay? Okay, now we're going to have a look at your big, beautiful eyes. So, what I want you to do is just follow my finger and keep your head straight. So, just your eyes move. Can you tell me when my fingers go out of your vision? Look to your right, over here. Look to your left, up, stay nice and still. So, I'm going to put some glasses on you and I'm going to ask you some questions based on what you see. Are you ready? Good. Let's begin. I'm going to place that over you. Do you feel comfortable? Great. So, I want you to tell me what is the first thing that you see. Letters. And can you work your way from top to bottom? Just go through them. Keep going. Very good. And what about now? Brilliant. Can you tell me which number is yellow? What about red, blue, and green? What color did I not pick? Okay, purple. Very good. Now you will see two different slides, like lenses, and I want you to tell me which one is more clear for you. So this is the first one. Take it in. And this is the second one. One more time. The first and the second. Which one seems to be clearer for you? Perfect. And now the same thing, but different lenses. So the first one and the second one. Which one seems to be more clear? Okay, perfect. We're just going to remove those glasses. How do you feel? Great. Now, I want to check your breathing and your oxygen level and also your pulse. Okay, so I'm going to put this on you. It's going to be a little bit cold. Just going to get you to lift your shirt a little bit. Okay. And I want you to take a deep breath in through your nose, hold, and then out through your mouth. Let's do it together. Okay, I want you to take a deeper one in. Try to really fill in your lungs. Very nice. One more time. In. Amazing. I'm going to do it on your back. And same thing. I want you to take a deep breath in and out. Out. In. And out. Brilliant. Okay. Now, I'm going to get you to put your finger inside here. Gonna turn it on. And just like that. And we're going to hold that. Perfect. Your oxygen level is how it's meant to be. Really good. And so is your pulse. You can see that you exercise, which is really good. Please keep it up. And one thing that I actually forgot to mention, I would also like to take your temperature. So, mouth wide. I'm going to put that underneath your tongue and hold it. And wait. We're nearly there. And to finish off, your cranial nerve exam. Are you ready? Good. So the first thing we're going to test is your smell. I'm going to close your eyes and I want you to tell me if you smell anything. I'm going to put something up to your nose and I just want you to take a quick sniff. Just like that. Can you smell anything? Alright. And can you describe it? How about now? No smell. Alright. Now, I want you to follow the tip of this brush with your eyes only. Please try not to move your head. I want your head super straight. Okay? Let's begin. Now I'm going to get you to close your eyes, and I will tell you to look in a certain direction, and I'm looking to see your eyeballs move, but with your eyes closed. So, close. That was excellent. Do you feel lightheaded or a little bit like a high feeling, dizzy, weird? No, you feel good. Okay, very good. We have another exercise that requires you to close your eyes. I'm going to be touching your face with this tip of the brush, and I want you to tell me where I'm touching and if you can feel it. That's all. Let's begin. Your cheek. We are nearly there. I want you to put your hands like this on mine and press as hard as you can. Okay. And now I'm going to press on your hands, and I want you to try to keep them the way they are. So don't let me push them. Very good. And now you push my hands down. I'm going to do the same thing to your shoulders. I want you to keep them up like this, and I'm going to try to push them down. And don't let me. Don't let me push them down. Very good. Do this for me. Take your time. Perfect. And now I want you to stick your tongue out. Put it up. Put it back down. Side to side like this. Good. It seems that we have completed all the tests that we were meant to today, and your results are really good. Well, you're very welcome. I hope this was an enjoyable experience for you, and I hope to see you next time. Thank you for coming in. Goodbye.